So if we're speaking on solutions based off of the problems presented from these findings, I mean, again, so many different avenues that we can look down this, right? But obviously one of the first ones that I think of is appropriate education resources, appropriate literacy competency for this at-risk group. How exactly are we doing that now? I mean, as you said, they're more likely to trust their peers and more likely to trust the internet for potentially for discretion than they are to seek out information from physicians. Is there a middle ground that we can make there?
I don't know. I wish I could say definitely yes. I think that people are, as long as they perceive stigma, they're going to be looking for information in private. I think part of the solution to the dilemma that you're posing, which is a very real one, is how do you get people to be more familiar with PrEP and with people who use PrEP? And to me, that's sort of that's what occurs to me as the solution to the dilemma we face. One of the questions we asked as part of our study was, do you personally know anybody who has either is currently a PrEP user or who has ever used it? And that it was a small percentage, but among the guys who were familiar with somebody who had ever used it, stigma was much, much, much lower. The perception of obstacles was much, much, much lower.
Yeah.
So community-based projects that can find a way to involve people who are active PrEP users, or who have used it in the past and chosen not to continue with it, but can give an honest explanation of what their experiences were, I think would go a very long way toward helping people to feel more comfortable with the prospect of taking this medication and give people a lot more confidence in the information that they're getting when they do actually seek some out.
Yeah. Yeah, I mean that absolutely makes sense, right? Better instances of patient advocacy in forms that are more intimate, and maybe that part is bettered by, I guess, access, right? I mean the discussion I was just having prior to us connecting this afternoon was with a leader in California public health discussing the individual means by which they're providing PrEP access to particular populations and assuring that as much as we are progressing towards individualized options for PrEP, we're also individualizing the means by which people can access them. So taking away those barriers, those excuses to beginning it because, oh, I don't have insurance. Oh, I don't have a regular physician that I go and see. So how would I get a prescription for? Oh, I'm not sure if I'm an at-risk patient and no one would tell me anyway. So it would be a waste of my money to do that. Taking away all those barriers and just making it as simple as, if you are at risk, here you go. You can start it. So do we imagine it's feeding all the way into that maybe that's the baseline issue that we need to address first, is just better access, and as a result down the line it improves adherence?
My general sense is that access to PrEP is not all that bad, but people don't necessarily know that they have access to it, and that they have such easy access to it.
Sure.
That many people are questioning, and it's something we found in our work. Many people don't know whether their insurance companies would cover it, for example. Many people don't know whether, if they went to their personal physician to look into PrEP, whether that information would be shared back with their employer. And I think in the midst of a very conservative political climate where nowadays you even have the Supreme Court weighing in on reproductive rights, I think there's an increasing level of discomfort for a lot of people about the extent to which their employers really may have access to information that they have no business knowing.
Right.
So when it comes to PrEP, I think you've got some issues, some real issues there about that personal sense of safety and security. How much can I do? How much can I look into without my employer knowing?
Yeah.
And that would only apply to people who actually think that they either have health insurance or who think there's good reason to believe that their health insurance would actually cover PrEP.
Right.
A lot of the guys didn't know that we spoke to.
Wow. That's just You would think, again, I can't speak on their behalf. You would think, of course, that that would be a priority to some extent when considering your health insurance coverage if you are potentially at risk of this.
Yeah.
But again, it's to each their own in terms of information. Dr. Klein, do we think maybe? I mean, like you said, we're about a decade into these options being available, and we're still at a point where like individualizing options are, it's still in the infantile stage of
Yeah.
progression. And in terms of other infectious disease care, it's way behind. And of course, it's made huge strides, but it's still got a lot of catching up to do. Do you imagine that, just by the nature of progression of time and just natural clinical research and progression of care and development of trends, that these sort of rates will take care of themselves, that they'll improve naturally? Or is this something we need to start putting in these interventions now?
I don't think they will cure themselves naturally, because I think you always have a new, let's say if you're talking about the population we've been working with, men who have sex with men, you always have a new population of people who are becoming aware of their sexual orientation for the first time, and who never before ever gave thought to the risks associated with the types of sex that they're looking to engage in, or the types of sex that their partners may be engaging in. So I think there's always going to be this new generation of people coming into the mix who have never heard of it, and who never had, in their mind, never had specific reason to give the matter much thought. I do think that with time and with increased visibility, both of people using PrEP as well as just PrEP in the media, I think there's a chance that people will become a little more aware of it. Just in the time since we actually did our data collection, for the first time, I've started seeing some television commercials that focus on PrEP and PrEP promotion. I had never seen one before we started work on this study. And just in the time that we started doing it, they've started to appear.
Yeah.
I happen to live in the Washington, D.C. area, which is one of the HIV epicenters in this country. And you even see it a little bit here and there in terms of bus advertising, like along the side of the public transit buses. And I don't think they're very clear about what it is, but at least if somebody has heard the term, seeing the words might get them a little bit intrigued to find out more.
Yeah.
But right now, I think there's a disconnect between getting the word out and how gentle, how indirect, really, a lot of even the promotion on TV has been.
It's very roundabout.
And I understand that. I mean, I realize that they're trying to thread a needle with a public that is uncomfortable dealing with sexuality and with sex and with the risks associated with, that can be associated with sex. And at the same time offering a medical product to people who need it. It's a fine line.